Hi, everybody. Welcome to our Winona webinar today. I'm Angela. I am the Director of Social Media at Winona. I'm here with Dr. Green and Dr. Brown, and we're going to be here to answer your questions for the next hour, roughly. So please feel free to start adding your questions into the chat. If you're new here, just pop in anything that you'd like, and we'll try to go in order. Whoever we see first, we'll read first, and so forth. And yeah, just leave us your questions when you're ready. And to you guys.
So Dr. Brown, why don't you introduce yourself?
Sure. I'm Dr. Cathleen Brown. I'm the Winona doc in Pennsylvania. So I take care of patients in the state of Pennsylvania right now. And happy to be on here and to answer some questions for you.
And my name is Dr. Mike Green. I'm the Chief Medical Officer of Winona. I'm also a prescribing physician. Gosh, I lost track of how many states I'm in, but I'm in a whole bunch of states. And so there's a pretty reasonable chance I'm your doctor or one of the two of us. And so, yeah, we're really here to answer your questions. So if y'all can start putting questions in, so we're not just sitting here looking at each other, it goes a lot better if we have questions to answer. So traditionally, I do a little monologue, kind of explain something to stall for time while you guys are putting your questions in. And so I want to tell a little story that has an important reason for it. When I was 17, I was in a really horrible car accident. Somebody fell asleep on the road, crossed over the yellow line, and hit me at about 65, 70 miles an hour and knocked me over a cliff. I spent multiple days in the ICU. I spent 6 weeks in traction. So I was in the hospital for about 2 months, and then I was in a body cast for another couple of months. It was a pretty horrible experience. Fortunately, I recovered. I'm standing up right now, so everything's good. But the interesting thing was about 3 to 6 months later, all of a sudden my hair started falling out in clumps. I mean, like crazy. And it was really scary. And so my mom took me to a dermatologist, and he, looked at me, got the story, and he told me about a medical condition called the medical word. Dr. Brown, why don't you say it better than me?
It's called telogen effluvium.
So 17, actually I was 18 by then, year old me, it was explained as telogen or telogen arrest, which is the English word of the Latin effluvium. The concept is that the hair is normally on a bunch of different cycles. There's growth cycles, there's rest cycles, there's falling out cycles. And so a little bit of your hair is doing different things at all times. And so it's normal to have some hairs fall out and other hairs grow. And that is sort of an equilibrium that's established. When there's some kind of traumatic event, like for me, a bad car accident or a big hormonal shift, like when you start HRT or when you have a baby, it can sort of shock the hair's growth. And so all the hairs sort of get stopped and they arrest in the same sort of stage of development. And then that gets better and it kind of goes back on. And then the problem is there were all these hairs that were in the same kind of moment in time, and they move into that fallout phase at the same time. And so it seems like all your hair is falling out, because it kind of is, but it's not falling out permanently. And hairs start growing back in, and then everything gets back into a normal cycle and you get back into that equilibrium. But for that sort of short amount of time, it can be pretty scary because it feels like you're going bald. And we get a lot of that with hormone replacement therapy, because when you start hormone replacement therapy, that can be one of these initiating triggers that can get the hair into that kind of cycle. And so sometime later, could be a few weeks or it could be even months, all of a sudden all these hairs are falling out and it's scary. And it seems like, oh my God, this medicine is making me go bald. And it's not, because the hormone replacement therapy won't do that. But there's going to be a time, a short amount of time, where it feels like all your hair is falling out. But then things cycle back together and your hair gets back to normal growth. And in fact, for most women, the end result of hormone replacement therapy is to have thicker, healthier hair, to end up with more hair in that hair to be healthier. But it can be scary going through it. I know I experienced that. I know Dr. Brown has, I think, a story as well from childbirth.
Yeah, it happened to me after having my second child. I remember being in the shower and just looking at the amount of hair on the shower floor and just panicking, and I immediately went to get my thyroid checked and went and had all these other tests done. But it was simply the same phenomenon, the telogen effluvium again. And it totally repaired itself. Within a couple months, it was back to normal. So, but that was because of the sudden hormone shifts after having a baby that caused that. So, similarly, with starting HRT or changing your dose of HRT could even do it. We can see this in some patients. Not every patient will experience it though.
No, most people don't actually, but it's totally, it's a scary thing. We've both been through it and know that. And so I totally understand why people, message in, oh my God, my hair's falling out. But you got to keep the faith and hang on, and it cycles back, and your hair ultimately will become better. Should be thicker and healthier than when you started, but it can be a little scary.
Absolutely. How are we doing with questions, Angela? Do we have some to start going through?
We have some questions. Are you ready? Here we go.
We're ready.
Yes. Brenda would like to know, who is at high risk for blood clots, and can you experience bloat?
So patients that are high risk for blood clots are patients that either have a pre-existing medical condition that makes their blood more clottable, or what we call hypercoagulable. Smokers are a higher risk for having blood clots. If you're sedentary, if you have a lifestyle where you don't move very well, you don't move your body, then that can also make you higher risk for having blood clots. There's several genetic issues that can be passed down in families that can make patients more prone to getting a blood clot, such as what we call a DVT, which is a deep vein thrombosis, or a pulmonary embolism, or PE. So if you have one of those conditions, or if you've had a clot in the past, then taking hormones would actually be a little higher risk for you. So we would recommend not doing that through Winona. You'd rather want to see a doctor in person to really talk about your risk. And then what was the second part of the question, Angela?
It says, can you experience bloat? So I don't know if that's like a separate question or yeah.
Yeah, I think that I see this among a lot of my patients, especially in the first few weeks when they're starting HRT. And I had patients complain about this even when I was doing birth control management, in the office as well. Anytime you're starting hormones, your body responds to those with a little bit of water retention, and that can be sensed as bloating. So I always tell my patients when they're first starting their HRT to kind of ignore the scale that first couple weeks. I don't want them to panic, because if they see the water retention and they see that water weight is up a little bit, they're going to panic because their weight has gone up on the scale. But they just need to get through that acclimating period. And then once their body is used to the hormones, it usually goes away.
Right. Yeah.
So I want to add a couple things as far as for the clots. One thing that people don't, I think, understand or are surprised about is that birth control pills actually are a much higher dose and also use synthetic hormones than hormone replacement therapy. So the risk of blood clots from or stroke from birth control pills is much higher than it is for hormone replacement therapy, because the dose of hormones is so much higher. It doesn't mean that we want to put you on hormone replacement therapy if you have one of these, clotting disorders, or you've had a history of a DVT or a PE. But for things like smoking, for instance, somebody over 35, I wouldn't put a smoker on an estrogen-containing birth control pill. However, with HRT, it's actually considered safe because the dose is so much lower. So there is a big difference there that I think is surprising for some people. I know I told my wife that. She's like, really? So my wife is a very intelligent woman. She's a very successful artist, but she has no medical background. So she's a great sounding board for me. Because sometimes she's surprised by things that I'm surprised she's surprised by. That was one of them. Like, oh, you didn't know that? Oh, I guess people don't realize that. But birth control pills are much more dangerous than hormone replacement therapy, just because of the dose and also the types of hormones. And the other thing with bloating, I think that there's probably some slowing of the bowels, especially with the initiation of estrogen. So, your stomach empties slower, your bowels empty a little bit slower. And so estrogen can be a little constipating, which can cause some gas. So there's sort of two reasons: the water retention absolutely for the bloating, but sometimes it's also a gas issue. That also, your body gets used to that, and it usually gets better pretty quickly. But using things like gas axe or really walking around more can help, move the gas. If you're really constipated, using something like Miralax can also help with the bloat. So those are things that that can also help. But usually it's a sort of temporary thing, usually in the first weeks of treatment for most people.
We have another question. This is from Andrea. She wants to know, how do you know what levels are needed? Are there labs done before you prescribe?
So we don't recommend checking labs before prescribing. So some doctors out there will, when you go to them and you complain about menopausal symptoms, they'll want to run a lab panel for you. And they'll check things like estradiol, and they'll check your FSH. But really, there's no data out there that shows us that any of those levels correlate with where you are in that perimenopausal transition or menopausal transition. So the best thing to do is actually assess your symptoms and see, what symptoms you're experiencing, and base our dosage and our initial medication based on your symptom profile, basically. And then we can adjust from there. We can kind of see how your body responds to the medication, and we adjust, with that. But we don't recommend checking the lab values before starting.
Yeah, this is sort of one of my pet peeves. It seems like I'm arguing with patients about this all the time. Unfortunately, the lab industry has become this huge industry out there. And there's a lot of people peddling labs. The other thing is that in some instance, a lot of doctors are doing labs because they generally think it's the right thing. We disagree with them, and so does actually, general medical advice. But everybody does things a little bit differently. But there are some people out there, I think, that are profit driven, especially if they're running their own labs. And there's a lot of money in doing labs, and quite frankly, Winona can make a bunch of money ordering labs on you all, but that's not really what we want to do. We want to try and stay with the science, do it right, and do it as inexpensively as possible. You can waste a lot of time and money, doing saliva tests or dried urine tests or hair tests or blood tests, and they really aren't helpful for treatment, and the information's not really valuable.
Yeah, unfortunately, I've had so many patients that kind of went down that rabbit hole with other either clinics or online companies doing salivary hormone testing. And it's unfortunate because what they end up paying for these lab tests is kind of outrageous at times,
That's a lot.
So don't waste your time and money. It's not helpful.
Right.
This is something that
Our advice to you.
Yeah, that we do with symptoms. That works really well that way. It's a very safe way of doing it, and it works.
Awesome. The next question is actually a really good question. I hear this one a lot in our Winona Women's group. There's always conversation about DHEA. So this Tracy wants to know. There's a lot of contradicting information online about DHEA. Even the Mayo Clinic versus Cleveland Clinic have different opinions. Mayo says, don't take it. Can you explain why Winona has decided to add DHEA to their treatments and address some of the criticisms of DHEA by others?
Yeah, I think we could start off by kind of talking about how in the bodybuilding community and for people that are looking to enhance their, sport performance or, physical performance, those people actually use really high doses of DHEA to help with building muscle and help their endurance. And I think that's when we start to see, a lot of the side effects and issues with DHEA. And that's where a lot of the opinion of these professional societies, or, you're looking at one website that's saying not to take, they're assuming what doses you're taking or what those people in that community are doing as well. Dr. Green can speak more to why Winona decided to add it, because he's one of the founding doctors of Winona. So you can kind of talk to the historical why we wanted to add it to our formulary.
So yeah, testosterone is an important hormone even for women, and I think people always think of testosterone as the male hormone, but the ovaries make testosterone, and the ovaries get less and less efficient at making testosterone. So the average testosterone output in your 40s and 50s is like 50% of what it was in your 20s. So women don't need a lot of testosterone, but they need some testosterone. It's important for energy. It's important for weight distribution and weight loss. It's important for muscle mass. And it's important for libido. So there's a lot of benefits to testosterone. Quite honestly, if we could do it, we'd probably offer testosterone, although testosterone can be tricky because it's pretty easy to overdo testosterone and end up causing a lot of side effects, what they call androgen side effects, or basically giving you male characteristics, which most people don't want. And so testosterone is one of those things where it's reasonable to follow lab tests. But the other thing about testosterone is a controlled substance. And so we can't prescribe testosterone with the type of telemedicine that we do. The truth is, when we started, we could. Because of COVID laws, a lot of states had really changed their rules about what could and couldn't be prescribed. Oh, it looks like we lost Dr. Brown. She'll be back on. But we decided not to use COVID rules when we...
Oh, I'm here.
Oh, you're there? Okay, we just lost your picture. We decided not to use COVID rules when we launched Winona because we knew they were temporary, and we didn't want to get people started on medicine and all of a sudden we can't give it to you anymore. That seemed unfair. And so we really used DHEA as a testosterone substitute. The nice thing about DHEA in that in reasonable doses, like 25 to 50 milligrams, you're not going to push testosterone levels high enough to cause a problem for almost anybody. So you're not going to get those worrisome, male type side effects that you can get with testosterone. So it's very safe, kind of easy to use medication. You don't need to do drug levels with it, and it works. In fact, in 25 to 50 milligrams, it's very safe. It works, but it doesn't cause the kind of issues that we see with these really high doses. I don't anymore. I was doing powerlifting for a while. I kind of messed up my hands. I'm a surgeon, not a good thing. So I'm still in the gym doing lower weights. So I have a lot of friends in the gym, big guys that, that juice, they use testosterone. They're always, you should try this. I'm like, no, don't want to. But a lot of them use really, really high doses of DHEA along with a medication called anastrozole to block the estrogen because the guys don't want the estrogen. But, and in those doses, there's a lot of risk involved. In fact, DHEA is a banned substance in a lot of professional athletics or competitive athletics. So that tells you that it works or they wouldn't be banning it. But for the kind of benefits that our patients want, increased libido, weight loss, a little more energy, those kind of things, you don't need those giant high doses. 25 to 50 milligrams is an adequate dosage without the kind of risk. So that's sort of the history of like why we chose DHEA. It also, I'm well aware of the Mayo Clinic. They really poo-poo it and this kind of thing. There are, pretty good studies that show that are what's called placebo-controlled studies, which are the best kind of studies that show that in menopausal women, DHEA does help with weight loss and muscle gain and the kind of things that we're after. So we know that it works in these dose ranges without the bad side effects. So it's easy to take, it's safe, and it works. That's why we use it.
Awesome. Okay. Let's see. Oh, we have Dr. Green. Amy says, hi, I've been on meds with Dr. Z for about 10 days, feeling good. Not much change yet, but my question is the cream, patch, or oral pills more effective and much better than?
So, in my opinion, for most people, they're all pretty equivalent. And so it really comes down to, personal choice. What seems better to you, to put a little cream on every night or take a pill every night or to put a patch on every few days. There is a price difference, and so that also enters into it as well. As far as effectiveness, they all work well. I have found that there are some patients that seem to respond to one over the other, and it's not something that I'm able to predict in advance. So I've had patients that are on the cream, we kind of max the dose out, doesn't seem to be working. We switch them over to a pill, and all of a sudden, boom, they feel great. And I've had other people on pills, and we max the dose out, it's not working. We switch them to a cream, and boom, they feel great. I don't know why, quite honestly. Yeah. The human body is really varied. And I wish I could predict that in advance, but it's not really something I can. But I would say for the vast majority of patients, they're going to respond well to pills, patch, or cream regardless. So it really comes down to personal choice.
Right. And what they can do to their lifestyle the best, when are you going to remember to take it?
Exactly. Yeah. And what's not going to kill you in the pocketbook, depending on where you are financially. There is some theoretical benefit to the transdermal, which is cream and patch versus the pill, in that there's this thing called first pass metabolism. So when you take a pill, that gets absorbed through the GI tract, mostly your stomach and your intestines, and that blood flow goes basically straight to the liver. The liver is what's responsible for breaking down the hormones in hormone replacement therapy. And so you get this sort of what they call first pass, where it goes through the liver first, and then it goes to the rest of the body. And so the liver gets sort of this big bunch of medicine all at once. And it's a little bit more taxing on the liver. Now, for most people that have normal livers and don't have health problems, it really doesn't really matter. But when you use it on the skin, it gets absorbed into the general circulation and then eventually makes its way to the liver. So it's a little bit more gradual effect on the liver. So in theory, somebody that has some borderline liver issues, maybe some lipid issues, maybe a little bit safer to use a patch or a patch or a cream over the pill. And so that is a potential advantage of the creams or the patches. And there are situations where that's important. I would say that most of the time, that's kind of a bonus, but it's not a make or break thing. Would you agree with that, Dr. Brown?
I agree. Yeah.
Okay, good. We have a question about insurance. Cheryl wants to know, do you accept Medicare, and how does the HRT product that you use differ from what our Medicare prescription plans offer?
So we don't accept insurance, but we've had patients that can submit things to their insurance or use their FSA or HSA cards, through their health insurance to pay for the products. But we exist because, some doctors out there are not really comfortable prescribing hormone replacement therapy, and just for the ease of getting the medication to patients, we don't accept insurance and we don't have to wait for the approval process and waiting for an insurance to pay for medication. So you pay for it in advance, and then if you choose to try to submit it for your insurance, you do that on your own. But most of our patients just pay for it outright. And then really the other question was, what is different about our medications compared to like what their formulary has with their insurance?
Mm-hmm. Right.
So, there's only so many different products that are out there, and there's standard formulations that are out there that are, the regular medications you can get from a pharmacy that your doctor could prescribe. But they can't really be adjusted. The doses really can't be changed, to make it unique for you, really to respond to your symptoms. So the main difference, it's similar hormones, although some of the HRT products that are from the pharmacies, might be different dosages and might be different forms of estrogen and progesterone. And so it's not exactly the same. Our medications are more bioidentical to what your body produces itself. Whereas some of the other things out there, so one of the most common medications that a lot of women are on is Premarin, which the word Premarin is from pregnant mare's urine. So they actually get the hormones from horse pee. And make the hormone that you're taking from that. When I first learned that in my OBGYN residency, Dr. Green, I just thought, oh my God, I can't believe people are putting this in their mouth.
I used to joke, well, what could be more natural than horse pee, right? That's not the kind of natural product you necessarily.
I don't know about you, but I don't know what horse estrogens there are. There's a lot of extra hormones in that particular pill that are not bioequivalent to a human being, to estrogen from a human woman. So I wouldn't want to take it personally. But that's one of the ones that's been around the longest, that a lot of insurance programs will pay for because it's an old medication. It's much cheaper now. Generally, when medications first come out, they're pretty expensive. And then when they can go generic, the cost drops down. And that's what a lot of the insurance companies want you to use, is the old generics that are out there too.
True.
The other thing is that our compounded creams are fairly special. Those are not going to be available on your insurance plans. And most doctors are not going to be able to prescribe those. I can tell you, I see patients, I live in a little town up in the mountains in California called Lake Arrowhead. And we have a little rural health clinic, and I see patients there just a couple of half days a month just to be part of the community. I can't write them for creams from that place because I have no pharmacy to use. So if they want a hormone cream, then they've got to come to Winona or another like site. Actually, there aren't really, most of our competitors online don't have creams either. So, or you've got to go to a compounding specialist. And so that's a big difference. Our compounded creams are really unique. They're made specifically for you individually. They're compounded by our pharmacists. They're not big pharma like the commercially available pills and patches. They're really, it's an art, and we have some really skilled pharmacists. The other thing I've noticed is the progesterone in particular seems to be a big fight with insurance. To use micronized progesterone, there's a brand called Prometrium, which sort of first came out with this, but to use micronized progesterone, which is it's the one progesterone that's bioidentical, it tends to be not on most formularies. And so they end up wanting you to use Provera or one of the other synthetic progesterones that have a lot more side effects and a lot of problems with them. So I've noticed that in my little rural health clinic, that whenever I try to prescribe micronized progesterone, it's like a fight. And generally patients either have to use a medication with more side effects, or they're going to have to pay out of pocket for the progesterone. So the nice thing about Winona is that, it's easy. You're getting something bioidentical. Again, we do everything we can to keep the cost down. By the time you're done waiting in a doctor's office and, paying for the gas, which nowadays is quite a bit to get there, and then you may or may not get your prescription, and then driving to the pharmacy and all that, and with your copays and deductibles, Winona is really not that bad of a deal.
Mm-hmm. Yeah. Okay, we have a question from Josephine. She says, I had an actual period recently after months of very pale spotting. Blood was cold or thin. This was preceded by water retention, tenderness, and some cramps. Please tell me this will go away. I like to know that.
So without really knowing where she was in her menstrual life before this, if this bleeding was in response to starting HRT, I don't know if that was included, if that information was included in the question or not. It's hard to know and how to respond and if it's going to go away. Generally, when patients start HRT, it can change. If they're still having regular periods, it can change the quality and the duration of their periods a little bit. But generally over time, if a woman is still having active menses every month, usually their periods will get a little lighter and a little bit more predictable once they're stabilized on their dose of HRT. Okay. For patients that have gone through menopause, meaning that they've gone a full year without a cycle at all, when they start HRT, it can be normal to have some spotting when they first start their medication because their body is responding to the hormone that's in the medication. But generally that goes away on its own.
Yeah, I think she just added in that it was a couple weeks into the treatment that this happened. So
gotcha.
That makes
sense.
sense.
So yeah, so that could be her body responding to the hormones, but it should go away.
And it's really important that you message your Winona doctor if it doesn't, because, it's first month or so, starting HRT can trigger a period.
She wrote, woohoo.
Yeah.
Yay, it's going to be away.
Good.
But if 3-4 months come by and all of a sudden it's happening again, that's something that we need to know about so we can take care of you. So don't just ignore that. We're here to help. So please let us know. And we can tell you, yeah, this is okay, and this will get better, or this is something that maybe we need to evaluate. So it is important to communicate that way.
Awesome. Okay. Annette wants to know, she's been taking testosterone in a cream form about 3 weeks ago after doing a blood test for the wellness center. But after that visit, it felt like the doctor didn't even ask me about what I was feeling. It was just going up with my blood test. Bottom line is I'm not feeling confident that my issues are being addressed. I found Winona online, and I was wondering if I'm able to change over, or should I see what I've started through and make it work?
I would say if you're not comfortable and if you're not confident in the person who's taking care of you or the treatment that you're getting, you absolutely have every right to change and to have a second opinion from someone else. So you certainly can switch over to Winona. I wouldn't keep going back to a wellness center or taking a medication if it's not serving you or helping your body.
Yes.
Yeah, it's important to take control of your health, because nobody's going to be more interested in your health than you are. We try to be, but honestly, and so it's really important to feel comfortable with the people that are taking care of you. I'm always awed at people, how people put their trust in me. It's a big responsibility that I take seriously, through Winona, but also, I meet someone for the first time and all of a sudden I'm delivering their baby, and it's I don't know what's the right adjective for that.
Humbling. It's humbling.
That's the right word. Yeah, and we really appreciate the trust that you put in us and your other doctors, but we need to earn that trust as well, and that's really important. You feel comfortable with the person taking care of you.
It's so nice to hear you guys say these things. I know this about you anyway, but just it's so nice to hear from our doctors. Like, we all know that you care, but it's just nice to hear. So thanks for saying that. Kristen wants to know, she's still getting her period. The cycle was 2 weeks early. She feels awful. Terrible mood swings, slight depression. I did have a cream dosage increase a few weeks ago. I think overall I feel good, but I'm worried about these awful period symptoms. What else?
So if she just had a cream dosage change, this could be her body responding to that change in dosage. And, if that dosage is doing better for her as far as, treating her menopausal symptoms, treating the things that we wanted to address with the treatment, like the hot flashes, night sweats, then I would tell her to stick it out a little longer, and that it should improve with time.
Okay, that's good. Cheryl has a question. Women over 70. She says, typically, what do women over 70 use as bioidentical hormones? Example, low estrogen and progesterone, but some testosterone still exists. I'm not looking to gain weight, as I need to lose weight and belly fat and to control facial hair, and I do not want facial breakouts with DHEA and hair thinning.
Do you want to take this one, Dr. Green?
We're looking at each other like, all right. So here's the problem. It's considered really risky to start hormone replacement therapy at 70 or even over 60, but particularly over 70. And the issue really is mostly because of heart health. And so hormone replacement therapy is actually beneficial for your cardiovascular system. It's what we call cardioprotective. It helps decrease your risk of heart attack and stroke and these kind of things. But it's sort of a long-term thing. And if you're already at high risk, because sort of the damage has been done for the 20 years you've been postmenopausal, starting that hormone replacement therapy can actually cause a problem. So in, there was a big study that looked at this. What they found was that in the first 2 years, there was this sort of spike in problems for women that were over the age of 60 and had not been on hormone replacement therapy. And there was an increased risk of heart attack and stroke and other terrible things. The interesting thing was, if they survived those 2 years, then they went back to having, protection again from the hormone replacement therapy. But there was this sort of initial first 2 years where there was some risk. And so at 70, it would be risky to start hormone replacement therapy because it could trigger a heart attack or stroke or other problems. So in general, at Winona, we don't start hormone replacement therapy for patients over 60 because of that risk. As far as the details of your other questions, because of the whole 70 thing, it's sort of a moot point because, really starting hormone replacement therapy wouldn't be safe for you. And it'd be a lot of risk for the gain that you're trying to get.
Okay.
I feel bad telling you that, but it's, we don't want to, fix your hot flashes and then kill you with a heart attack. That's just, we haven't done you any good. And that's important to think about the big picture.
But this is good because it means that there's a lot of integrity. I think, some doctors might not respond that way. And I mean, good doctors do. But it's nice that, we're able to be really honest because I think we get a lot of these calls. where people have questions with documents or different. Kelly has a question. She said she feels confused. Her OBGYN said her progesterone is low, 1.7, relative to her estrogen, 2. So she's like, do not need to take estrogen, and she only wants me to take progesterone. I have crippling anxiety and depression starting 1 to 2 days before menses and lasting until after ovulation. Should I be on both estrogen and progesterone, or would estrogen make it worse? She wants me on birth control instead. Very frustrating.
I think I would want more information about Kelly before answering that question, because, without having a chart in front of me and wanting to, I want to know, how old is she? Is she having menopausal side effects? Menopausal symptoms, I mean. Having a high estrogen level relative to progesterone, again, your hormone levels can vary from day to day, but they can also vary at different times of the day. So I don't know when your doctor checked the progesterone level, at what point in your cycle that was, because the progesterone fluctuates throughout the entire menstrual cycle. Every month, if you were to check on a different day, you'd get a different number value. So without really knowing more details, it's kind of hard to answer that question. But if she's still having cycles, so it sounds like she's still having menses, birth control itself, should help to regulate periods. And, there are medications that are FDA approved for what we call premenstrual dysphoric disorder, the PMDD, which, if you have the crippling anxiety and depression before your period, sounds like it could fit into that category. So that I would maybe ask about that to your physician. But I think that's all I can really answer with that question.
Yeah, she just popped in and said she was 46, but I didn't get any other details. So,
okay.
Yeah,
So,
maybe she can message one of you.
Yeah, if you're a patient, then already, then you can message us. Otherwise, you could onboard, and that will give us your health information. It's also kind of interesting that on the one hand, your doctor says you don't need estrogen, but then they want to put you on birth control pills. So the whole thing is a little confusing to me as well. I think that progesterone estrogen ratios aren't particularly helpful because they're so variable about where you are in your cycle that they're not particularly predictable. I mean, your progesterone estrogen ratios are supposed to be skewed towards progesterone at the beginning of your cycle. They're supposed to be skewed towards estrogen. At the end of your cycle, they're supposed to be skewed towards estrogen at the beginning of your cycle, and they swap around. So it's not a very helpful. I don't know. I've never used that number or even looked at it because I've never really thought that it'd be usable. On the other hand, I agree with Dr. Brown as far as your problems just before your period. Sounds like it could be PMDD, which there are other medications that can be really helpful for that as well. So if you want a second opinion, we'd be happy to do that if you want to onboard, and we'll have more information that way and be able to give you a better answer.
We have another question about DHEA.
Someone wants to know, is DHEA natural like a supplement? That's one. The part 2 is, why are there so many complaints about DHEA and face?
Sorry, I couldn't hear that last part.
I missed you. Yeah, it goes a little choppy.
Yeah,
Angela,
you're kind
sorry.
So
Yeah.
the first part was, is DHEA natural like a supplement? That's 1. And 2 is, there are complaints about DHEA and facial breakouts, and why is that?
Yeah, DHEA is a supplement. If you were to look in any vitamin store, sometimes even GNC, you'll find DHEA on their shelves. It's something that's out there, but anytime you buy a supplement that's an herbal or a mineral, you never can really guarantee what the contents of that is when you're buying it off the shelf or from Amazon. And so, the difference is that the DHEA that we prescribe through Winona is certified by our pharmacist. So, it is a supplement, it is out there. So it makes sense that you may have taken it in the past. And then as far as the acne with the DHEA, because when the DHEA is processed in your body, it's converted into estrogen and testosterone. And sometimes when you first have an uptick in testosterone in your body, you can have acne breakouts. And that's pretty common. It's the way that the testosterone really affects, the skin itself. I don't know how better to explain that, like physiology of that, Dr. Green, if you have a better explanation.
It's usually temporary is the important thing.
Yeah.
And so sometimes people get an initial breakout, which is annoying. I get it. And then it usually kind of, as breakouts do, fade away. And then for most people, that's kind of it. And it doesn't necessarily resurface. Every now and then, out of nowhere, you get this rogue breakout. But then again, that can happen to anybody. But the DHEA does, I think, increase acne at the beginning, but for most people, that's temporary. Also, I want to tell a little DHEA story so it's kind of cool. I'm excited about this. We become big enough that we are able to demand our DHEA be manufactured specifically for us to our specifications. And actually, a couple of the founders just toured our pharmacy in Twin Falls, Idaho, and sent a picture of these boxes. It's like, this is 500,000 DHEA tablets. And it just kind of blew me away. It's like, wow, we're ordering 500,000 at a time. And honestly, we ordered a 1.5 million lot. And so thanks to you guys, we're really growing and becoming big enough. And so when you are ordering that kind of quantity, you can demand what you want from the manufacturer. And so our DHEA is absolutely what it says it is. The other thing, some of you have been through this with us, and I apologize, is we're getting it in really small little capsules, and that manufacturing lot, they got a little bit behind, and we had to scramble and get some DHEA from another source, and those pills were bigger, and I apologize for those. But
a lot of patients were concerned that their dose was changed by mistake, or we saw a lot of feedback on the pill change, pill size.
But we've got that solved. Now we're ordering in such huge amounts that we should be fine. But sort of the moral of that story is that because we've gotten big enough, we can really be picky about what we get, and they're making it specifically for us the way we want it in these little capsules. And so that may or may not be true of other DHEA. So again, because it's a supplement, it doesn't have the same kind of regulations that some of the other medications might. And so, it's only as good as whether you trust where it's coming from. I trust where ours is coming from, and it may or may not be okay with the stuff you can get at Amazon or the flea market or wherever else they may be selling DHEA. It's becoming our DHEA lecture.
The DHEA webinar today. Somebody would like to know if they can take HRT while on thyroid medicine.
Yes, you definitely can.
All right. And
absolutely safe. Yeah, we get that question a lot. It really is not a problem at all.
The follow-up to that is, will fatigue and tiredness improve on HRT?
Yes, it should. So that's one of the common symptoms, and a lot of women will have that symptom before they develop hot flashes or night sweats. So the fatigue generally does get better once your hormones are kind of stabilized on your medication. The DHEA actually goes a long way with that, giving you more energy as well. So that's something that should improve when you start treatment.
Mm-hmm. Okay, there's a couple more questions related to age. Since we hit on the over 60/70 question, we have some follow-up questions. So I'll read those out. The first question is, if you start HRT before age 60, do you then continue after that? That's fine.
I'm sorry. I've got to say something here. I would not take healthcare advice from Chrissy on Three's Company, but that's my own personal opinion. Sorry, I don't mean to bag on somebody's hero, but she's not a doctor, and she has some interesting things out there. maybe exercise advice, but
Yeah.
I wouldn't take medication advice from Chrissy. Sorry.
I
Sorry.
forgot what your name was on that show.
My brain remembers insignificant trivia, unfortunately.
All I can think about her is the Thigh Master and those old commercials with her doing that Thigh Master routine.
Yep.
She's got a lot of things out there.
Yeah,
That's right.
Good for her, but I wouldn't take medical advice from her.
Yeah, the two questions were from different people, but on the same topic of age. One is, if you start HRT before 60, can you continue after 60?
Yes. The key is starting it before the age of 60 to be safest. But once you're established on HRT, it's safe to continue for as long as you need it. So some women are on it for a few years. Some women may decide to stay on it for 5 or 10 years. When the time is right, we will try to take a patient off of it when they're ready. And we kind of see how they respond, but it's absolutely safe to continue, because I've had a couple of patients that got in and started their medication like at 58, and they said, "Oh no, are you going to cut me off when I turn 60? No, we're not going to stop it like abruptly like that."
That's
because
good.
It's still safe to continue as long as you started before that age.
Right. So it's just your body's just acclimating to having it in your system so you can keep going, as opposed to like a cold start after 60 where your body kind of freaks out and goes like, ugh, and then it's a risk.
Right.
Because
And that's when that heart risk is increased, what Dr. Green mentioned earlier.
yeah, that makes sense. So yeah, the other thing was just sort of commenting on how there's a difference of opinion for, some people's OBGYN or a naturopath, or someone else might say, "Oh, we think it's okay to start it at a later date." And that's just really a matter of ethics, right?
Yes.
Well,
And, we might want to say the difference between, so there's doctors out there that call themselves doctors that are naturopathic doctors, but they do not have a traditional medical education. They don't go through the same training that we do. They haven't done, 4 years of medical school and then another 4 years of OBGYN residency, learning everything there is in and out about the female reproductive system. And so I think that you have to look at that when you're trusting your health with someone, and you have to look at their credentials, and don't be afraid to ask somebody what their credentials are and what their experience level is. But that's the big difference. Me personally, I want the expert if I'm going to be trusting them and having them take care of me. So just be wary of that out there.
Yeah, that's good.
and there are, I can tell you, I had a patient not that long ago who was like 60 in 2 months. And this was in the office, and we sat down, we talked about it. I explained the risks, and I said, it's not like at 59 and 364 days, everything's fine. And at 60 and 1 day, all of a sudden it's a disaster. It's a slow, gradual thing. And so we talked about it, explained the risks. We did what's called shared decision-making. She understood that she was at increased risk, and but with that understanding, I was willing to take that risk. And I felt comfortable in that situation prescribing for her. It's a little bit different, in my opinion, being in a room with someone that you can examine and talk to face to face. So I might make different decisions in an office setting than I would at Winona. With Winona, I'll be honest with you, we do some cherry picking because we don't want to cause problems. Our number one absolute priority is patient safety. And so we sort of go the extra mile on that. And, we maybe disqualify more patients than absolutely necessary, some borderline cases. But it doesn't mean that somebody in an office won't prescribe it necessarily might be appropriate. But in the type of environment that we have, we want to be extra careful and extra safe to make sure that we don't hurt anybody, because that's really the most important thing.
Absolutely.
That's awesome. Someone would like to know if the patch is waterproof.
Once you apply the patch, it should be. I think The real important thing with the patch is that you apply it on skin before you put any kind of moisturizers or creams on. I know a lot of women will put on moisturizer either in the shower or right after. You have to make sure you have a good adhesion of the patch on your skin. But you could go swimming. You could live your life and get it wet. I mean, because you still have to shower when you're using your HRT. So you have your patch on, you get in the shower with it. You don't have to take it off or cover it in a special way or anything like that. As long as the patch is making good contact with your skin, the medication is being delivered.
Yeah, it's definitely waterproof. For people that spend a lot of time in a pool or in the ocean, if you're a surfer or you do laps for your exercise, sometimes the patches can fall off and they're expensive, so that's a bummer. So one trick you can do, there's something called Tegaderm that I've had some patients put over their patch when they go swimming to basically protect the adhesive so that it doesn't fall off. But the patches absolutely is waterproof. It won't wash the medication out. But if the patch falls off, they're expensive, so better not to lose one. So that's a trick. If you're going to be, surfing or doing laps in a pool, that you might do to keep the patch from falling off.
I think I'm just checking to see if we have additional questions.
Oh, here, I like this one right here because I was just talking to my wife about this.
What's that?
Jamie James says, with growth of Winona, will we lose the personal touch of y'all? No, absolutely not. And honestly, I can tell you, this is one of the things I stress about because that would be the wrong way for us to go. So right now, we have 9 physicians employed prescribing. In my head, I'm thinking that number is probably going to be 50 by the end of 2023. And so we want to keep, I don't want to overwhelm anybody. I want to keep numbers down for each individual doctor so they have time to spend with the patient and give you that personal touch. The other thing is, our corporate culture, so to speak. We're a bunch of people that get along well. And I can tell you, I've been in practice now 23 years. And except for the first year and a half, I've been in a position of being the boss where I hire and fire docs and stuff like that. And my number one priority all along has been hire nice. I figure pretty much any board certified OBGYN can get the job done. That's not the complaints. I never get complaints that somebody's incompetent. The complaints I get is they were not nice or mean or rude. And so I never hire people like that. That's sort of my number one hiring criteria. It's like, if you're not nice, I don't really want you working for me. And so that's really important. And so that's something that, right now, we're still kind of mom and pa, but even as we grow and hopefully get to the point where we're not mom and pa, that's going to be the culture that's going to continue, because I think that's really important. So that personal touch, that needs to be there. And I think, my patients in the office feel that same way, because that's the kind of person I am. That's the kind of person Dr. Cat is, Dr. Brown is. That's the kind of person that works at Winona. So, and that's the way we're going to keep it.
Yeah. That's awesome. It makes me excited to all of our, even our staff. I love everybody. It's been my great pleasure. Thank you, Dr. Green.
Sorry, I can't.
What you're saying, Angela, because it's getting choppy again.
Oh, really? I was just saying thanks for holding that bar up high, to keep, the expectation that civility at a minimum is a requirement to work at Winona, that it's not just hiring anybody to fill the shoes, that it really matters. Demeanor matters, because you're dealing with people who are, vulnerable, and they feel concerned, and they want someone to probably, you want someone to take your needs seriously, but also to be sort of comforting in a place where you can feel safe and to share your personal history and your problems. And it's just nice that you both create this nice container for folks to feel comfortable and to share
Well, it's important, I think, and I always tell patients, I like to empower patients, but, this should be with anything you're seeking healthcare for. If you're ever going to a provider or physician somewhere, and you don't get that sense of comfort, you don't feel like you're being listened to, you just don't have a good feeling about it, you absolutely have every right to be comfortable with your care and to be able to ask questions and to be able to feel like your questions are being taken seriously and being answered. So I think it's really important that, patients take control of their own health and kind of navigate, their own healthcare. But by choosing people that help them, really,
Yeah.
I don't know. I'm worried about the patient earlier who said, should I just stick it out and keep on the same treatment? I think there's too many people out there in the world that think, well, I've already gone to this person. They have my chart. I don't like them. Doesn't feel right, but I guess I'm just going to keep going there. No, don't. Be the squeaky wheel. Go find somebody that you like and that you feel comfortable with. It's so important. This is your life you're trusting them with.
Yeah.
That TV show House, it's a great show, but it's like, I would never go to that guy.
No.
He's a great dog. I would never go to that guy. You don't need a grouchy, nasty person. There's plenty of nice, smart, good doctors, and that's what you deserve. I see a question about pregnancy. So HRT does not prevent pregnancy. So if you're still at risk of pregnancy, the Winona medications are not going to take away that risk. We don't want an unintended pregnancy, so we don't want any misunderstanding about that. Generally speaking, if you're 50 or over, even if you're still menstruating, the chance of a pregnancy is as close to zero as you can get. It's someone gets pregnant over 50 without even with reproductive technology, they go to a fertility specialist and they give them all kinds of medicines and they get them pregnant. That makes big headlines. That's how rare it is. So to get pregnant on your own by accident after 50, really, that would be a case report. That would be a publishable thing. So you really don't have to worry about it. Before that, it's possible. And, we do see 47, 48-year-old women with an oops pregnancy. So that's important to understand what this does and does not do. And this doesn't provide contraception. So important to understand that.
Cool. Oh, we have one last non-Winona question for you, Dr. Green. Do you get snow where you live?
We do. We had our first snowstorm. It was so much fun. I've lost track of my days. Tuesday night, we got only about an inch and a half, 2 inches of snow. Not enough to have. It was perfect. Enough to be pretty, not enough to have to shovel. I live.
Those are the best.
Yeah, I live at 6,000 feet elevation, sort of the local Southern California ski resorts. So yeah, we get a lot of snow. It's really nice.
Awesome. That's great. Oh, somebody else is typing. Oh, it's Kimberly. She's typing. These are good questions. I'm happy that we're covering a lot of ground on the age and the DHEA, because I see a lot of repeat questions about some of the same symptoms, same things in the and so it's nice for this platform to be able to address those questions, because I think people get really concerned about the different opinions that are out there. Kimberly also wants to know, when she's been using HRT since January and has changed her life. Oh, she's not asking you to tell us. It's changed her life for the better. That's awesome.
Good. That's good to hear.
That's great. I'm happy.
Great.
You don't know how much we love hearing that. It's it's nice to hear the successes. Thank you for sharing.
Yeah. That's really nice.
Yeah, it's kind of heartbreaking sometimes when patients come to us and they've told us, they've been suffering for so long, and they've gone to their OBGYN, and then they've gone to their family doctor and keep being told no, there's nothing I can do. It's menopause, deal with it, and it's just so sad, that no one's willing to help patients. But, we're still dealing with that negative stigma from the Women's Health Initiative study a long time ago. And there's just so many, as a result, there's so many people out there that don't have the training, don't have the education, and just are not comfortable. But unfortunately, that leaves so many women across America without help. So that's why Winona is here.
That's right.
Yeah. It's really great. You guys are Winona's a godsend for so many people that really show up when we need it the most. I think, like when you have these terrible experiences and then you find someone like you or Dr. Green who are really willing and able and ready to help you and listen. It's so important.
Yeah. Oh, and you're Kimberly's doctor, Dr. Green.
Hey.
She's happy.
Well, I'm really glad that I've been able to help you.
Yeah, that's awesome.
That's what we're here for.
Well, if anybody has any last questions, they can type them in the chat. Feel free to add in anything you would like to know, your last questions.
Well, we're going to get done on time, which is good because I've got date night with my wife tonight.
That's a lot more fun than what I'm going to be doing. I have to wrangle my kids and get them to bed.
Oh, that's sweet. Oh, okay. Well, this is
all right.
All right. Well, we appreciate all of you, and
Yeah,
I hope this was helpful.
It's been really nice to see all the questions and nice to spend time with both of you online.
Absolutely.
Yeah, it's good.
Well, have a good date night, Dr. Green. Go
Thanks.
spoil your wife.
All right. Good luck with the kids.
All right. Good night, everyone.
All right. Good night.